During the rooming phase, typically this would involve a medical assistant or a nurse, utilizing those best practice alerts, or just the gaps in care that were identified during the pre-visit planning process. This is a nice opportunity to utilize standing orders, which allows for another staff member to be able to create an order for the lab work based on a certain criteria, like for anyone with diabetes who hasn't had a year, or hypertension as well. And also educating the patient on the why for the labs. Why are they necessary? We have heard there's sometimes stigma around urine testing, and really just being clear that this allows the provider to have the best information to understand their kidney health. And we will be sharing some specific educational materials that can be helpful to do that. Wanted to share a sample standing order also available in that MCRH toolkit. This can be adapted based on if this is something you'd like to implement at your clinic, to call out specifically what kind of tests to be ordered. And this is important because it helps to improve clinical efficiency, taking some of that onus off of the providers and decreasing missed opportunities during the visit. To do this, it's important, as you've all mentioned, garnering that support, identifying the champion who's going to kind of lead this and keep it top of mind, writing out a particular policy, assessing and then reassessing how it's working, and is it being maintained. These are a few of the educational materials that we'll be sharing with you afterwards. Trying to keep these, as low literacy as possible. Also, some of them, like the one on the right-hand side, is adapted for different communities, as well as available in Spanish and in Arabic. So really focusing on the ways kidneys can keep you healthy, some of the key statistics, the understanding what risk factors put you at risk for kidney disease, and getting, really encouraging people to get the two tests done.